Hello and welcome everyone. Thanks for joining us. I'm Margaret Malone, an investor here at Flare Capital. Flare Capital is a healthcare-focused venture firm investing in innovative healthcare technology companies. We are excited to have you join us today. This is our 17th quarterly expert roundtable, and today we'll be discussing longevity and the promise to expand our health span. Let me briefly set the stage before we dive in with our speakers. We're thrilled to spend the next hour digging into the exciting field of longevity, which sits at the intersection of cutting-edge research, technology, and medical innovation. This interdisciplinary field is focused on prolonging healthy years, preventing disease, and addressing the root causes of illnesses. Our guests today are innovating across all of these areas. Longevity may be a hot topic today, but the quest for the fountain of youth isn't new. Many of the biohacking solutions and treatments we're hearing about today have been around for centuries, and today the research is finally catching up. Additionally, consumer awareness and interest in the field has surged, fueled by industry breakthroughs, media coverage, and frustrations with the traditional US healthcare system, which we all know too well. A recent study found that nearly half of Americans are committed to finding ways to live as long as possible. Despite the growing interest in extending health span, half of the US population still suffers from at least one chronic disease. About a third of Americans lack access to primary care services. And if they do sign up for fitness apps or wellness apps, they typically churn after 3 months. Additionally, 90% of the healthcare spend today is directed at treating chronic diseases reactively. Proactive and preventive healthcare services are increasingly important in the context of the growing aging population and the increasing prevalence of chronic disease in our country. But solving this likely requires more personalized approaches and better user interfaces to really make maximum impact. With the rise of biohacking, advancements in AI and automation, and the potential of drugs like GLP-1s to address aging mechanisms, we are really entering the golden age of innovation. In fact, investment in 2024 in this sector is already outpacing 2023's total financings. However, despite the momentum, the longevity market faces unique challenges: consumer awareness, consumer spending power, regulation, and ongoing research, just to name a few. These scientific breakthroughs have spurred waves of innovation, some successes and some failures, and we'll dive into some of the key lessons from these ventures later on in the discussion. While the wealthiest Americans are leading the charge in accessing many of these longevity programs, our speakers will share how they are scaling these innovations for a broader audience. Evidence-based care models designed around a specific consumer audience and aligned to the right business model, we believe will ultimately win this space. So I'm hopeful these data points we've previewed today will provide a solid foundation for the discussion. Technology is truly unlocking new possibilities in this field, offering Americans access to evidence-based anti-aging treatments that hopefully will extend health span and reduce age-related chronic diseases. With that, I am excited to introduce our distinguished panel of experts who will share their insights on the field. We'll open with a fireside chat with Lance Armstrong, founder and managing partner of Next Ventures, on the macro trends investing in the space in his own personal longevity practices. Then we'll shift into a panel of innovators to discuss areas that are ripe for more near-term innovation within this ecosystem. I'm pleased to be joined by Dr. Hilary Lin, founder at Lavora Health, Dr. Robin Berzin, founder and CEO at Parsley Health, and Pranitha Patil, co-founder and COO at Function Health. And then we'll close with a fireside chat with Dr. Alex Zavarankov, founder and CEO at Insilico Medicine, on market insights, the research, and the promise of AI in drug discovery. So with that, I'm excited to invite Flare Capital executive partner, Barsha Rao, to the stage for a conversation with Lance. Barsha, it's great to see you here.
Thanks, Margaret. It's great to be here today. Lance, thank you for joining. It's great to have you with us. Let's jump right in. For those who are less familiar with your journey from world-renowned professional cyclist to investor at Next Ventures, can you tell us a little bit about the pathway to investing and how you got here?
Sure. First of all, it's great to be here. All this stuff is fascinating. Obviously, healthcare and quote unquote longevity has been a part of my life. I'm 53 now. I turned professional in the sport of triathlon when I was 15 years old. So I've been at this a long time, seen a lot of ideas come and go. And I've always been an investor. I think as long as I ever had any sort of income, I was interested in investing. I was Certainly interested in people and sourcing great founders. I was the first check into active.com, for example, in 1997, which was started by Jim Woodman, who I met from my triathlon days. And then his life played out, just continued to write not just angel checks into some notable ones such as Athletic Brewing, Waterloo Sparkling Water, but also on the LP side, and was certainly very fortunate to back Chris Sacco with Lowercase Fund One and Brad Silverberg with Ignition, some of the more notable funds in the last 15, 20 years. So it wasn't a stretch for me. And so to combine my own personal health journey, and we are focused more on longevity, but I view my journey is more of a 360 journey just because I think most would say, or could argue that I've been the most optimized athlete in the world at one point, but I've also been patient number one on death's door with the diagnosis, with the potentially very fatal diagnosis. So I've seen it all, coupled with, again, 38 years of playing in the endurance world. It's nice to be on this side and see great deal flow and back great founders.
That's great to hear, Lance. And I think your path as a cancer survivor should not be under discussed, I guess. I've been super impressed with just the sheer amount of money you've raised actually as well. So I just wanted to mention that. As you think about investing with Next Ventures, maybe tell us a little bit about your whole person health thesis and like the origin of that and how you envision bringing that to life in the next several years as a part of the firm.
Yeah. And I think it really is, it's just an extension of what I explained with my own personal journey. The one thing that I think stands out, and I think most of us on the Zoom can agree, is COVID changed everything. Right? It certainly changed it for me and my family and our team here at Next Ventures. Pre-COVID, we invested in, it was a little, I would say, more tip of the spear. Now, obviously, we did Aura Ring, which has proven to be a fantastic investment. But we did PowerDot, a mobile eSTEM unit. We did Hammerhead, a next gen cycling computer. And then as COVID hit, and I think we all realized, as did the world, that, oh my gosh, we're not going to live forever, or maybe we're all going to die soon. Whether or not that was even near reality is another discussion, but it was an awakening for us internally, for the world. And quite frankly, it was good. I think in it, all of these tailwinds that we're all going to discuss with longevity, I think, because people have been kicking this around forever, but the true tailwind came out of COVID and people thinking once they got past it, they thought, okay, great, we're all not going to die here. And next question or next goal is how do we live forever? But post COVID, we really started to look at healthcare broader and really play more downstream and less so upstream. Not that we wouldn't. It's still stuff that we know inside and out. But as we start to play with more downstream care, companies like Vital Bio and Pear Team and Trial Library, and including, I guess, our 21st deal in Fund One is a deal that we all here, or a lot of us here on this call did together, perhaps goes back to the top of upstream care, but it's an exciting space. I think it's ripe for change and people want it. And you see it culturally. Like you see the people that we all talk about on a daily basis, they're household names now, whether it's Peter Attia or Andrew Huberman. I don't think they're household names without COVID and this focus on longevity.
So just going into that a little bit more, this topic of longevity is it's taking so many of the headlines, it's generating so much buzz. But there's actually a lot of ambiguity around between the science and what's actually real and also the business opportunities. Since you've sat at the forefront of longevity from being a performance athlete and now as an investor with companies like Aura and Humane and others, as you mentioned, why do you think longevity is having its moment? Is it primarily the post-COVID effect? Is it because of new developments in science, perhaps? Or is it some combination of, and what do you think why is it coming about now in the way it really is? It's really so top of mind.
Yeah, I do think it's both. And I think we're continuing to evolve there. And I love it. I would love that wheel to spin even faster. If you took Aura as an example, having lived the life I've led, and of course, sleep is so important to recovery, and recovery is so important for performance. I mean, the way we used to track sleep at the Olympic Training Center in the late 80s, early 90s was ridiculous. But we've come this far, and here you have, and it isn't just Aura. You could look to Whoop, you could look to 8 Sleep. These things actually work, whereas they didn't necessarily work before. And I think there's exciting frontiers like the gut. Personally, if you ask me, what is the most exciting thing for me? Because I've done everything in terms of diagnostics and scans and exams and trying to get as many answers as I can for my body. The gut is the one that sits out there that I don't know that I have the answers to, and I don't know that we can collectively agree that it's there yet. But at the end of the day, there is no magic bullet here. To me, and I've implemented a lot of this in my life, these are very simple answers. If you wanted to make it simple, which you can't, lifestyle factors, decision making during the day is unbelievably important. And I think the one issue I perhaps have with the quote unquote influencers in this world is that they have created this army of people that hang on every word that they say. That answer is not around the corner. Now, the answer for me personally, and I'm again just speaking from personal experience, is some very significant lifestyle choices that I've made, and massive benefit for me. Even, and you guys, I'm sure the rest of the Zoom will talk about GLP-1s and this obsession with weight. To me, one of the best tools in weight loss is how many people in America have a scale in their bathroom. Probably most people. What percentage of those people religiously step on that scale? It's probably a very low number, right? So you can look at it from a lot of different directions.
So as we talk about some of these thoughts, some of them simple, some of them more complex, how do you think about platform versus point solutions? Because you have point solutions that might be out there for weight loss, for nutrition, for social engagement, for fitness adherence, versus a platform that might help to bring it all together. And I'm just curious because you know that so much of this works together, and yet it's sometimes hard for one platform to do it all. So how do you think about whether there will be one winner, there'll be lots of winners, and from an investor perspective, and also just a consumer?
Yeah, I think it's still TBD. I would like to think that there will be multiple winners. And as far as the solutions go, and again, just having my own lived experience, I have personally just ran my own platform. Right? I've done all the diagnostics, all the blood work, full body MRI and imaging. Here's a great example. I've always had high cholesterol. And so I did a whole round of blood work probably 6 months ago, and my cholesterol came back very high. And my doctor called me and said, it's probably time we start having this conversation around starting you on a statin. And I started sweating. I said, what? Absolutely not. Like, I'll try anything. I'm not starting a drug that I have to take for the rest of my life. And so I gave it some thought, and I called him back and I said, are you telling me it's 2024? We're doing all these amazing things. You're telling me there's not some solution here so that we can actually look in my heart? What is the concern? I got it. Cholesterol's high or on the higher side. But what is the real concern? It's calcium score, it's soft plaque, hard plaque. He says, there is this new test. It's called Clearly. It's not always covered. It can be expensive. I said, great, I'll take it. So I went and did the Clearly test. They called me back 4 days later and they said, I can't believe I'm having this conversation. I said, okay. He says, calcium score is 0 and you have 0 soft plaque, 0 hard plaque. I said, great. So we can stop talking about the statin. So I've navigated all this myself. Most people with that story that I just told, most people just listen to the doc and say, all right, call it in. I'll run down to the pharmacy and start. And so that breaks my heart, honestly. And I think we can do better. Now, do most people sit there and rack their brain around what the other solution is? Probably not. They default to what the doc says. But that's a heartbreaking story. I would have been livid if I sent down that path.
Yeah, and I think what's really insightful also about what you're saying here is that you've had to be your own quarterback, basically. And that's a challenging situation and job. It takes a lot of time, knowledge. You have a lot of that from your history, and a lot of
Hmm.
people don't have that. And so, do you feel like there's a role for a platform to be that quarterback? Could AI potentially play a role here? I'm obviously everybody is talking about
Right.
AI. Where do you think there might be increased knowledge that could help people make some of those challenging decisions that then they can be cross discipline?
Yeah. Look, I knew that AI would come up in this discussion at some point. I'm probably the last person on planet Earth to speak to it. I will say that if I think of my own little kitchen cabinet, I've been blessed. If I have a fairly serious health question, I pick up the phone and call Peter Attia, or I call Darren Phelan, or I could reach out. My kitchen cabinet is stacked, and so I'm lucky like that. Can AI be that solution? It was interesting. I had coffee yesterday with Malcolm Gladwell, who's, as we all know, I
Mhm.
think one of the most creative, smartest, wisest people around. But he's also a fanatical athlete, primarily a runner, and he's obsessed with Strava. Like, he loves Strava. And we started talking about Strava, and he was going down this path of, I don't understand why Strava hasn't made it easier for me as a 61-year-old runner who runs quite a bit, who sometimes gets hurt. How am I not seeing how it is possible for other 60 plus year olds to run the same amount of mileage and not get hurt or not have injury issues? And what's going on? How are they not directing that to me? And so it was fast. I had never thought about that. I don't run a lot, so maybe I told him, I said, you stop running. I mean, pick a lower impact sport, but there is a play there. And I think us as a firm, we're not. I think we're careful when it comes to AI because that's not our strength, and we don't like to pretend. We like to invest in what we know or what we can actually find out or learn to, so to speak, know. But yes, it's going to change. And if you think about more serious issues, cancer and dementia, and the big ones. Look, the test I referred to earlier, the heart test called Clearly, that's all AI, right? So you could say without that test and without AI, 3 years ago, I'm on a statin for 3 years. That's just, again, it's a heartbreaking story, but now it's a success story.
So I think we, just to bring this to a little bit of closure, I think people would be really remiss if I didn't ask you this question. As a former professional athlete and cancer survivor, who you've spent so much time on your health and performance, what does an investment in longevity look like in your personal routine today? You talked a little bit about the tests you've done, but how does it get manifested in maybe your workouts, your eating, any other kind of sleep? Any other types
Yep.
of practices? Cold plunge, maybe?
Yeah, I know. Oh God, I wish I could say cold plunge. I think there's something. Look, the answer is very simple. January 14th of 2024 was the last time I drank alcohol. The single biggest benefit, tectonic shift in my life. And not that I didn't walk into a room with 12 people that I love more than anything that all say, there's your bags packed and we love you and we support you. And now you're going, I just said, I don't think this fits in my life right now. And I eliminated that from my life. And on every level, now I've always been a great sleeper, so I know that's the obvious one for a lot of people when it comes to alcohol. But on every other level, work life, home life, mental health, physical health, look, there's a very simple hack. It's not that simple for a lot of people, but the difference in my life was incredible.
Amazing. Thank you. And I know people would love to hear more and keep in touch. So I'm sure there'll be a way after this, but appreciate your thoughts and spending time with us. I'm now
You
going to turn
bet.
things back over to Margaret for a panel discussion with Hillary, Lynn, Robin Berzin, and Prathika Patel about the companies they are building serving this demographic. So Margaret, over to you.
Thanks, Marcia, and thanks, Lance. Great to have you here. Thrilled to bring the next couple of panelists to the stage. Robin, Hillary, and Pranitha. I believe you're up here. I think you're getting spotlighted shortly. Let's just go ahead and jump in to give everyone some context, especially for those who may not be as familiar with the organizations that you were working. Let's start by giving some background. So maybe we'll do a little bit around Robin, just quick one-liner on the company that you're building and how you fit into the bigger longevity picture. Robin, let's start with you.
Hi, everyone. I'm Dr. Robin Berzin. I'm the founder and CEO of Parsley Health. We are the largest functional medicine platform in the United States. We are a 50-state functional medicine clinic serving consumers, payers, self-insured employers. We help people reverse chronic disease and optimize health, and we are helping people recover from and improve conditions like autoimmune, gastrointestinal disease, metabolic health, mental health, hormonal and endocrine conditions, fertility. We've been around since 2016 and scaling ever since. And we also work with patients who come who want to optimize their health, get proactive testing, understand what foods they should be eating, what medications they should be taking, and how they can live with greater vitality now into the future.
Awesome. Thanks, Robin. Hillary.
Hi. All right. I'm Dr. Hillary Lynn, and Livora Health is redefining longevity care by blending cutting-edge precision medicine with deep, meaningful physician-patient relationships. And the longevity ecosystem is bustling with innovation, and we believe that our approach is different because we focus very much on the relationship. And our relational model ensures our proactive health support that is not only accessible, but creates an exceptional experience for not only the patients, but our clinicians. And we've chosen to focus early on depth before scale. And so we complement others on this panel that have leveraged rapid scaling, and I think really demonstrates the multiple strategies can coexist in advancing longevity care.
Awesome. Thanks, Hillary. And Pranitha.
Yes, thanks for having me. Function, I'm a co-founder and COO at Function. Function is an all-in-one health platform that starts with diagnostic testing of about 100 biomarkers that look at your organs and your organ systems, like Robin was mentioning, your heart, your hormones, your thyroid, your kidney, your liver, and really understanding what to do after that testing. So we provide you with actionable next steps on what to do. And the relationship to longevity is a no-brainer for us. The category here that we talk about quite often is active health management and health assurance. Like we heard from Lance, health is not made at a doctor's office. It's made at home. It's made with friends and community. And so what we focus on is really looking at continuous understanding of your biomarkers, not just the typical healthcare platform, which is looking at snapshots of your health over time. Our focus is really to give people back data on their data on their bodies so that they can own their health.
Awesome. That's a great segue, I think, to our first question, which is really focused around consumer adoption and awareness. And Lance mentioned this earlier, how difficult it is to actually practice what we're calling longevity medicine. So I'd love to hear from each of you kind of your take on the consumer adoption challenges. What are the biggest challenges that you're seeing today as you think about overcoming adoption? And maybe Pranitha, we'll start with you.
Sure. Yeah, the adoption piece is an interesting one. I think for many people that come to Function, they're what we call biocurious. They're interested in their biomarkers. Maybe they have a chronic condition, maybe they don't, but they're interested. And the biggest hump that I think most of our companies will face and the challenge we have is the behavior change on the other side. How are folks actually staying accountable to the findings that they have? And then what are they doing to ensure that those results come back on the other side, which is where the continuous testing twice a year is what Function offers, is really helpful for folks to get a feedback loop. That's probably the biggest thing when it comes to some of this consumer adoption for Function.
Awesome. Yeah, I love the feedback loop. Hillary, would love to hear if you have any additional insights.
I think some of the biggest challenges now is really in trust and education. Everyone's just so overwhelmed because there's a lot of people coming to the forefront with conflicting health advice and so much new technology, which is awesome, but very confusing. And it can even feel like the definition of longevity medicine is really abstract. I always get asked, is longevity medicine a form of advanced primary care? Is it performance medicine? Is it for me? So I think that what we need to do as longevity companies is we need to simplify complex science into clear, actionable insights with early rewards and prove our value through measurable outcomes, like mentioned, with biomarkers, but also with how people are feeling immediately. And also another challenge, which I'll tack on, is maintaining quality and accessibility, because this is truly a field that requires a lot of work because there's a lot of personalized treatment and intervention. But doing that across a large population is a true challenge that we need to face.
Yeah, so true. Robin, anything you'd add to that?
Yeah, we've seen tens and tens of thousands of patients at Parsley Health, and they really come to us for 3 reasons. There's a large group that is living with chronic disease. And I think to Lance's point earlier, why we're seeing the rise of the longevity movement and interest today, 40% of US adults under 65 have not one, but 2 or more chronic conditions. This is not for the worried, this is for the walking sick. And I believe there's over 300 people on this call. I guarantee many of you are living your lives with a chronic condition, and you may not think of yourself as sick, but you probably also don't think of yourself as a biohacker. And you're looking to feel better and feel better now. And so people come to Parsley frustrated with both primary care and specialty care. We have a system that is bouncing people back and forth between primary care and specialty care while they get sicker and then fall through the cracks. And that's what I saw in my training and in medicine at Columbia and Mount Sinai. Over and over again, I saw people living with disease for years, if not decades. And I saw that there had to be a third way, another way of treating these patients who have risk adjustable conditions that can get better. And that we could do that with a functional medicine approach that's blended with conventional care, which is what we do at Parsley, in a highly effective way and demonstrate great outcomes and cost savings. And that's what we've done. We show our independently validated data shows that Parsley is driving a 23% cost savings in a high cost multi-chronic population. And that has been validated data, and that's led us to work with payers and employers. That is one group that comes to Parsley. And I think that group is on the rise. And I think this confluence of chronically ill, living with something, and health curious, wanting to understand more about our health, are coming together in a rapidly growing population that has demand for all of the services you see here. And just quickly, the next 2 groups that come to Parsley Health, the next one is what I call the undiagnosed and unwell. They have symptoms, and their regular doctors, their regular specialists are not really listening to them. Often these patients are women, they're dismissed. They're told it's all in their heads. It's not in their heads, it's in their body. And through the root cause medicine diagnostic that we start with at Parsley, which is over 100 biomarkers, as well as a really in-depth look at your history and understanding of your social determinants of health, we use this root cause medicine assessment many times to help people who are living unwell, but don't know what they have, figure out what that is. And I think there's this other group, as I mentioned, that's really looking for that as a value. What do I have? What do these tests mean? And what do I do about it? And then there's a third and smaller group, which is, I think, the group that we're all came into this talk to talk about, which is the folks who are largely well, but are interested in data. They want to use their 8 sleep and their Aura ring and get their function tests and understand what's going on. And they just are voracious for data. I think that group it's noted to be small. It's a small demographic, but it's growing. And I think, to what Lance said earlier, technology has really assisted in that, because a lot of the technologies today to give you that data used to be not so great. And now they're becoming more available and more ubiquitous, which is feeding that segment. So we've got the chronically ill, the undiagnosed, the unwell, and then the more biohacker types. And I think all of them are growing segments with a massive unmet need in healthcare that we've certainly seen that Parsley has been able to serve.
That's great, Robin. And I actually think technology is such an important, or plays such an important role in this space and specifically. So let's talk a little bit more about that. I think AI can analyze vast amounts of medical data, identify patterns, predict outcomes, do what you just described, personalizing those treatments. Maybe, Pranitha, we can start with you a little bit. I'd love to hear how Function Health is utilizing AI today. Are there limitations that exist, and how have you guys thought about that?
Yeah, so we're building this as we speak. We thought about AI from the very inception of Function, machine learning and AI as a tool, as it is. It is a way to get information in a way that's never been done before. So one of our co-founders is Dr. Mark Hyman, and he often jokes, he says, what if we had 1,000 doctors like me in your pocket? That's what the AI and the technology that we are dealing with in today's society can do. And that's what we're looking to do at Function. So when you think about the power of intelligence from physicians, from research, and then from your biomarkers, and bringing those all together that's how we are planning on using AI from a medical intelligence landscape. It's bringing the data together that's never really been brought together before. When you go to your physician, even if you go to a specialist, they're not necessarily looking at your past medical records, your wearable data, your biomarker data, and then giving you a full picture. Our goal with Function is to be able to do that in a very clean way. And we fundamentally believe that the advances in technology with artificial intelligence and machine learning are going to be able to give us that pathway. Obviously, there's going to be limitations. There's more simple applications for AI that I think most of us are already using for supporting member experience, supporting physician admin time. Those are the easier wins, the lower hanging fruit. The biggest thing is going to be building the piece of the technology that's never really been done before, which is what I referenced at the beginning.
And Hillary, I'm curious to get your take on this. We talked a little bit on our prep session around just how technology can be used to really enable providers to deliver longevity medicine, even providers that haven't historically delivered longevity medicine. Would love to hear your take there.
Yeah, longevity medicine, like we've all been talking about, really departs from traditional reactive care because we focus on proactive, hyper preventive approaches and ultra personalized for each individual. So that's really difficult to do at scale. And at Lavora and everywhere else that we're talking about, technology is pivotal, but we also don't want to lose sight of that human element. To what Pranitha brought up, AI is an amplifier, and that's wonderful when there's an alignment between the provider and the thousands, maybe millions of patients or clients on a particular platform. But what we're starting to realize is that there are nuances and approaches by physicians. We're not quite there yet that we have all of the information. So I think that's something important. My partner's an AI scientist and strongly believes, that AI is going to be more knowledgeable than any of us doctors one day, but we're not there. And that means that we have some judgment calls that we need to make as humans, talking to other humans, our patients. So in our approach, we use AI-driven algorithms to help clinicians identify risks very early, much earlier than when the first symptoms of disease would ever appear, and certainly earlier than when guidelines typically recommend to start testing. And we personalize interventions based on each individual's needs, which is quite difficult to do in an age before you have AI's help. And same thing goes with remote monitoring tools, things like wearables. That helps us ensure that care is continuous. So rather than episodic check-ins, we have ongoing support. A lot of our care occurs over messaging, actually, and it's a supplement to, we like to have the face-to-face time, of course, but it's a needed supplement to make sure that people are getting the responses they need real time and can change their approaches to things. So I think there's multiple approaches, but to simplify it, there's definitely this scaling privilege or the advantage of AI scaling wise. And there's also a depth focused approach. Then both is really necessary in this upcoming longevity revolution.
Great. Let's switch gears a little bit to the business model. I think we talked a little bit about this at the outset. Many companies have, failed to achieve liftoff due to either business model kind of being incorrect timing potentially with the market. And I'd love to hear just from your experiences. And Robin, you alluded to this earlier around just the outcomes that you all have published. Partially started cash pay, now works with employers, payers, plans. Would love to hear from your perspective, what enabled that shift? What specifically in terms of outcomes were you all required to put in front of payers to get that coverage?
From day one, we had a vision that we would get outcomes data, prove that the functional medicine model at scale worked in real patients with real health conditions who have true illness and cost. And that would ultimately enable us to scale, not just in the cash pay world where a lot of the longevity services have historically lived, but to really break into the wider healthcare system, which is how the vast majority of Americans consume healthcare and expect to consume healthcare. And so we started cash pay to work out the model, get the data, and then to break in. And what's enabled us to do that is showing true longitudinal cost savings in a high cost population. And here's the rub and why I'm so excited about longevity in its current incarnation. It's funny, it's taken off. I'm now in the third 10-year cycle. It was really big in like 2005. And then it came back in the mid-teens in a really big way. And then it went under for a bit during the pandemic, and now it's back. So I do think these things tend to have a cycle. But I think what's really enabled us to break in that way is showing the outcomes in this high cost population. And often longevity has attracted folks who are pretty healthy and noodling on their data and want to know a little bit more. And that's great. That's amazing. Like, I have absolutely nothing against that. I want to see a lot more of that in the world, because if people get interested in their health, then it snowballs, right? We have a healthier population. That's a good thing. But from our payer and employer perspective, you can't save money in somebody who doesn't cost anything. And so their focus entirely is on cost savings in high cost populations. And so what we've been able to do is show material cost savings in very specific high cost populations: autoimmune disease, a population that's on high cost specialty drugs, oftentimes GI patients, cardiometabolic patients, female health conditions. And these are areas that I think haven't gotten a lot of attention. A lot of our healthcare system has focused for a long time on, when it comes to cost savings and value, on things like end stage renal disease and heart failure and sort of these end stage, highly catastrophic and very costly areas. But with that, we've not given enough attention to these conditions that are extremely high cost in a very large population, and are the people who are on the way to some of those end stage diseases. And so what we've been able to do is show our impact in those folks, our ability to manage some of those medications, get people off of some of those drugs, as well as our ability to manage more than one condition at once. And I think we have a lot of point solutions in the market. Some of them are extremely interesting, extremely powerful. However, the average human being only has the mental capacity to deal with so many solutions and providers and interfaces at once. And the beauty of, I think, our model and the functional medicine model is that we're actually often we're prescribing HRT for menopause, we're managing a GLP-1, we're treating depression, and we're treating cardiometabolic disease proactively in one patient in one visit. And so we obviate the need for some of the point solutions, because this high cost patient population is usually actually dealing with more than one thing. As someone who sees patients myself, I think of the patient I saw last week, where all the things I just said, the GLP-1, the HRT, the titrating off of one antidepressant onto another, very few people have one thing that neatly fits in a box. So we as humans are complex creatures. And so the ability to use a functional model to treat a high cost population, which is usually has 2, 3, 4 conditions. 80% of parsley patients have 2+ comorbidities, 60% have 3, 4 or greater. I think that has also in recent years been of interest to payers and employers who are looking for solutions that better match some of their highest need populations.
That's super helpful. And I know we're cutting up short on time. We haven't been able to dive into, I think the business model question is super important. And Pranitha, I think you probably have some great advice, but maybe we'll tie it into some advice for some founders. Any advice you'd like to share with founders who are building in this space? Pranitha, I would love to start with you. Oh, I think you're on mute.
Sorry. This goes for anyone starting a company, but the first piece of advice that I always got was just do it, start somewhere. Particularly with the longevity space, I love that there's so many players coming in. It's so welcomed because it means that the conversation is happening more broadly and across all the population. And so this ties back to the business model question, but for us, we really did one thing. We did one thing well. We started the company in 2021 and really only kicked off our beta in 2023, and we just hit 100,000 members. And we really just wanted to do one thing really well and wanted to focus on accessibility for our patients, because so much of concierge medicine is available to the wealthy. So that was our focus back when we started.
That's awesome. Hillary, maybe one sentence advice for founders.
I would say focus on balancing technology with human relationships and creating that outstanding experience for both your patients as well as your clinicians.
And Robin?
My advice would really be stay focused on the thing that you do so well that nobody else does as well. And don't worry about the competition. Don't worry about what other people are doing. If you are doing something really well that drives value for real people, for real patients, just do that thing exceptionally well.
Awesome. This has been such a great conversation. Thank you three for joining. Look forward to staying in touch. I will now pass it over to Vic for a conversation with Dr. Alex Zavaronkov. Thank you again.
Thank you.
Awesome. Hey, Dr. Zavaronkov, thanks so much for joining us. I think in this last section, I think the goal, a modest one, will be to figure out how everyone on this call can live to be 120 years old, if that is a good target for the next 15 minutes. But maybe just to start things off, for folks in the audience that might not know, can you tell us a little bit about yourself and the journey to starting in silico medicine, and maybe even if it's relevant, a little history with deep longevity as well?
Sure. Hi, everybody. Alex Javankov. I am the founder and CEO of Insilico Medicine. I also co-organize the wonderful conference that you see in my background, the ARDD, Aging Research and Drug Discovery meeting. So that's probably the largest meeting in longevity biotechnology in the world now, running for 12 years in a row. Next year, it's going to be the 12th, and maybe there will be also the kind of interim one in another country. It's currently always in Denmark, always by the University of Copenhagen. And it's a 5-day event where we get to see the frontier science in aging research and longevity, and also in the pharmaceutical industry. And we bring together several $1 billion of venture capital that usually presents as well. My background is in computer science. I'm Canadian, did my first 2 degrees in computer science in Canada, worked for semiconductor companies. One of them was ATI Technologies. It's a competitor of NVIDIA. Made a reasonable amount of money in my early 20s. I decided that it's time to go into longevity. So it's now more than 20 years that I work in the field. And instead of just jumping and building the company, as I always wanted, I decided to do my grad work at Johns Hopkins, worked for a number of labs, organized conferences to learn about this field and to cut the teeth and ensure that I don't make the mistakes that a lot of people made, because longevity biotechnology is actually a very old field. If you like, there is a website called longevity.degree. You can take a few courses on longevity medicine, but also investing in longevity. Thousands of people took those courses, and the kind of fundamental ground truth is that so far nothing worked, nothing succeeded, right, in terms of a major longevity company, even though people were trying to do that since the probably 1960s. And this new era of optimization and diets, exercise, sleep, or as I like to refer it, do what your mother told you, it's been around for a while. So if you go back into history and look at 1930s in the US or even earlier, people have been exercising in front of their radios. There were wellness and longevity agenda, and then somehow it disappeared, but now it's coming back. But one thing to learn is that nothing worked, right? So everybody died. Nobody lived past 122 and a half, if you believe Jean Calment. So my background, again, mostly optimized for longevity research. 2014, I went to NVIDIA GTC at the kind of cusp of the deep learning revolution, went back to my roots and presented and started the company out of NVIDIA GTC conference. The original idea was to utilize the power of deep learning for pattern recognition and identification of the different features in our biological data that affect our biological age and also bring us closer to death. And also the features that we could influence with certain interventions and drugs that could give us more time.
Maybe on that note, because I think there's a couple of things in there in terms of a major extension or longevity impact. This is what the scale we're talking about is living to 120 and beyond, as opposed to a couple extra years of life expectancy here and there. And I think the old adage, like, you can't fix it if you don't measure it. Beyond the years that we've been alive, can you help us understand what some of our aging clocks are and what some of the targets and the drugs that you're developing are aimed to extend?
Sure. First of all, there is as many clocks as there are scientists who can easily access computational resources and some longitudinal data sets. My first aging clock was published 2016, and we used very simple blood tests from labs. So think albumin, glucose, alkaline phosphatase, urea, etc. So simple features that come from regular visits to the GP, depending on where you do it. In some areas, it's very narrow, to predict your chronological age in a healthy state. And that's how we define the aging clocks. Then we, of course, expanded those aging clocks beyond just regular blood tests. We went into methylation, transcriptomics, proteomics, facial images. So pretty much, even I published a few psychological aging clocks. So you can build aging clocks based on survey data. You can mix those data together, and essentially, you are your age. So if you take the net totality of all data types that change in time, train a deep neural net and ping it to this specific time, that's going to be you. You change on every level. And on psychological level, we see that those clocks also tick. And right now, in my age, I probably wouldn't be able to make friends with myself when I was 20. So it's different people. And I'm not sure if I'll be able to make my friends with myself when I'm 70. So also different people. I hope I will. And many of those clocks are predictive of certain events. So you can actually predict certain diseases. If you are older biologically or psychologically, you are going to be very likely you're going to be exposed to certain diseases, increase of many different risk factors. And of course, the all-cause mortality is going to increase. So you're going to live shorter life. That's usually how those clocks are tested. And we spun out a company out of in silico called Deep Longevity, as you've mentioned before, which specializes still in many of those clocks. It started catering to clinics, providing insights to physicians how to use those clocks for clinical trials, for their daily work, for longevity medicine. Because if you are developing a drug, for example, in this area, how do you know that it's going to work in humans for longevity? And either wait until your population dies and you can see whether somebody on your drug lives longer, or you can try to measure all kinds of aging clocks and see which clocks are more responsive to the drug and which ones are ticking backwards, to be able to explain how the drug works and hopefully also to see the anti-aging effects. So aging clocks can be constructed utilizing pretty much any data that changes in time. And nowadays, with deep learning algorithm and generative AI, and with the computational power that's available to us, we can mix and match some of those data types and build multimodal aging clocks. So our recent work in the Precious GPT series, if you go to insilico.com/precious, you will see that we can train deep neural networks and generative systems, so multimodal transformers, on different data types at the same time, for example, methylation and transcriptomic data, and also some clinical metadata, to build models that can reason within multiple data types. And now we can query those models for not only aging clocks to see how well you're aging, but also identify some of the features that could be used as promising drug targets, that if we influence them, we would be able to roll some of the aging processes and possibly a disease process back.
Yeah.
My problem with aging clocks today is that there are so many of them. There is a consortium, aging biomarker consortium. Everybody who is developing the aging biomarkers should join. However, right now it's super easy to build a clock, and there are many of them, and many of them are being integrated into all kinds of healthcare services, but there are very few interventions that may work, so even potentially work. So if you look at the Rich Miller's intervention testing program, which is the gold standard for testing all kinds of longevity interventions in mice, there is only a couple, I would say a couple handfuls, so maybe 10 drugs, 10 interventions that tangibly work and extend lifespan in mice. One of those drugs is rapamycin, a very famous drug. Recently, we saw several other drugs being added to the table, but we are talking about small increases. Even the champion of them all, rapamycin, in combination with acarbose, gives you 20% in mice. So currently, nothing works, and nothing works in humans.
And maybe just to take it a step a little bit higher, a lot of us have been experiencing LLMs from a consumer sense for the last couple of years, and it certainly feels like a kind of step function improvement in our capabilities. Can you help us understand what the corresponding change in the technical capabilities that we have today mean for the pace of drug discovery that you're championing now, and what we might expect in the near future? Is there a tidal wave of new indications, medications that will be coming through the system at a much faster pace now that we have the technical capabilities to do? Are we bumping up against a capacity challenge where now all of a sudden we have the ability to solve all of these diseases, or at least develop some drugs that might have a chance in solving some diseases, but don't have the capacity to do? Maybe just put in context for us how AI has changed the world that you've been working in for decades and what you're most excited about.
Sure. My kind of general statement in response to questions like this is that AI can definitely increase R&D productivity in pharma. And just my team demonstrated that we can, in some areas, cut the cost and the time 10x and increase the probability of success for developing a drug. However, it's not magic. So you are not likely to see, let's say, 3x increase in the number of drug approvals 5 years down the road. You should not expect that. You should not expect that miracle. And to understand where we are today, you need to understand the drug discovery and development, the process, how drugs are discovered and developed, and also the sheer number. So the FDA approves approximately 50 drugs a year. So just think about it, 50 drugs. The entire world is working for decades, and you get 50 drugs a year. After I would say currently maybe $400 billion are being spent conservatively on pharma R&D worldwide, companies plus governments, and 50 drugs. Out of those 50 drugs, probably about 5 to 7 are truly novel. Novel meaning that it's a truly new concept. Everything else is basically an iteration on what has been approved before. And most of those drugs are not curative. One of the reasons for that is because it takes about 10 years to develop a drug to the market, even if you know the target already. So if you already have a protein target that you know is disease modifying, and you are very sure that it's going to work in a clinic, it will take you about 10 years to put a drug on the market. If you don't know the target in a disease or a pathway, for Alzheimer's, we still don't know. So go tell me a target for Alzheimer's, right? You can give me a few amyloid targets and maybe some oxidative stress targets, some very common aging targets. Most of them have been tried before, and most of them failed.
Yeah.
So we still don't know why.
And I'm sorry to interrupt, but I know we have to transition over to Margaret, and we should have scheduled an hour to talk through the details here. But here's to hoping that the regulations will catch up to the pace of innovation that you're driving, and really appreciate you for taking a few minutes here to speak to us.
I just want to add one other thing, is that now the US actually has a great chance because it recently appointed, according to the news, Trump is planning to appoint Jim O'Neill to co-head the Department of Health and Human Services. And if you look at his bio, that's a longevity veteran, right? After multiple years with Sense Foundation. And Robert Kennedy Jr. also, if you look at the background, very longevity focused. So let's hope that these two gentlemen are going to put the fire in the oven and ensure that some of the drugs that may have the ability to reverse aging are approved faster.
Here's to hoping, indeed. And with that, we'll transition over to Margaret, and really appreciate your time. Thanks so much.
Thank you, Vic and Alex. Really appreciate your insights today, as well as from the rest of the panel. We covered a lot of ground, but as you can tell, we ran out of time on almost every single discussion. We would love to continue the conversation. If you're interested, please reach out. And we hope to see you for our next expert roundtable. Thank you again to all of our speakers today, and look forward to staying in touch. Take care.